evening to everybody. And I'm very proud to welcome you to this particular episode because this is the milestone of 100th episode of the Different News podcast. As you see, I have my guest with me today, and it's a very special guest that I have on this 100th episode of the Different News. Welcome, Dr. Rajiv, and thank you so much for being on my podcast on this special episode.
Hi, Dr. Gargi. Thank you for inviting me, and it's an honor to be on your show. Thank you.
That's my pleasure. So, for my audience, Rajiv, I'll take a few seconds to introduce you. So, Dr. Rajiv Saini is a Harvard University graduate specializing in industry leadership. He is a dentist and periodontist by training. He is recognized for his expertise in oral systemic health research. His work primarily examines the host's inflammatory and immune responses to periodontal infections, establishing periodontitis as a significant risk factor for various systemic diseases. He is experienced in implementing scientific strategies in a variety of research and development operations, with his major focus on projecting research value propositions and mapping new avenues for scientific growth and innovation. His scientific portfolio includes more than 170 plus peer reviewed publications in high impact journals, 5 books, 3 book chapters, and multiple patents. His globally recognized scientific contributions and numerous research awards highlight his pioneering role in scientific advancement. Once again, welcome Rajiv, and I think it's a very interesting area that and very close to my heart that we are going to, talk about today. So I think I have a lot of questions. But before I delve into that, I know you have an extensive, rich academic plus industry career. So would you like to share your journey with us?
Yes, thank you, Dr. Gargi. And definitely, coming from a very strong academic background, spent almost like 15 years plus of my time here in different multiple academic settings while working in universities and healthcare and research institutes in Asia, Europe, and US. Definitely, academics is something very close to my heart. And I mean, most of my years working in these academic settings, my research was focused on oral systemic health, how we can optimize oral health in the best possible way so that it can give a better outcome for the overall systemic health. Coming back to my transition from academia to industry, I realized that one of the key feature is to convert the gap, or what you can say that is to bridge the gap between innovation and impact. I mean, in academia, I love the research, but I realized that translating science into real world solutions like better oral care products or protocols or clinical uh, regulations requires the agility and resources that industry can only offer. And that's why I pivot myself more into the industry so I can turn the ideas into the real world application.
Amazing, amazing. We really need to talk about oral systemic link at least at present time. I know a lot of people have been talking about it. So can you explain, or if I just ask you, what exactly is this oral systemic connection, and in fact why people should be even bothered to realize this aspect?
Yeah, definitely. I mean, the oral systemic connection, in a simplest way, refers to the relationship between the oral health and systemic health of the rest of the body. Inflammation and infections in the mouth don't stay local, and they can influence the rest of the body. And inflammation and infections in the mouth move to The other systemic health conditions like heart disease, diabetes, and even respiratory illness, pregnancy, adverse outcomes, and so on. So the healthcare professionals in general need to recognize the mouth as a window to overall health and not a separate system. There is an immense and tremendous amount of research which has already been present that established gum infection or the oral health infections, and in particular periodontitis, as the independent risk factor for multiple systemic diseases. And that's why it's our emphasis as being on the dental professional to mention that and to put it on a stronger verge like oral health isn't part of oral systemic health, and one should put a thorough emphasis on that.
Yeah, thank you, Rajiv. Because, yeah, you rightly said, because I think we talk about, particularly in the present scenario, if you see, we hear a lot about gut microbiome, and it's a very fantastic area as well. But I think somewhere, personally, this is my perception that somewhere we are failing to realize the importance of, our mouth, the oral health, because that's the gateway to the entire human system. I mean, you have to
Yes,
enter the palace through this gate, right? So,
yeah, yes, 100%.
uh,
And as you rightly mentioned, like chronic gum
yes.
inflammation can increase systemic inflammation and the worsening like insulin resistance in diabetes patient, right? Oral bacteria entering the bloodstream can contribute to arterial plaque in the heart disease, and also during pregnancy, oral hygiene linked to the low birth weight and even
Mm.
the preterm birth weight babies. So, altogether, the mouth is not isolated. It plays a very big regulatory role in systemic inflammation and immune response of the body.
Right, absolutely. So, if I have to ask you a quite a little bit of generic question, but I really love to ask that, how or what role does our microbes in our mouth, that is, if I put it as oral microbiome, play the role? What is this role in our overall systemic health? I know it's a very broad-based question, but maybe if you
Yeah.
can.
Yeah, I just want to give like an
Yeah,
overview of this
exactly.
topic. Like, so oral microbiome is basically what microorganisms are thriving inside the oral cavity at given point of time. And we know that hundreds and thousands of organisms are present in the oral cavity, irrespective of your oral health condition. So they are good bacteria, bad bacteria. So altogether, they compromises the oral microbiome. So in regular health scenario, when we say that a person has a good oral health, the balance between the bad and the good bacteria is optimal. So the good bacteria overpowers the bad bacteria and maintains a good oral health. In the conditions when we have a gingivitis or when we have a gum disease or when we have a periodontal disease or when we have any other oral manifestation conditions, there is a significant decrease in the amount of good bacteria and the bad bacteria overpowers the good bacteria. So this is called basically a dysbiosis of the oral cavity. Now, oral microbiome is a complex ecosystem that helps regulate immune and digestion and act as a first line of defense. So when it is disrupted by poor oral hygiene or even other conditions like smoking or overuse of harsh oral care products like that oral care products that contains alcohol, colors, fluoride, chemicals, or synthetic additives, it can lead to dysbiosis. So it fuel inflammation and disease elsewhere in the body. And that's why in Indian culture, especially in the Asian culture, when we used to have a lot of curd in our diet, so that gives a lot of lactobacilli, a kind of a good bacteria to boost the oral immunity, which we are not seeing in the Eastern in the Western culture, right? So that makes a kind of an understanding like why diet and your oral lifestyle also plays a big role in maintaining that oral microbiome.
Right, right. Thank you so much for this fantastic answer. When it comes to oral systemic, So of course, if I go out of our mouth and body, so it comes more about the collaboration of dentistry with the medicine. So I think it's a very burning topic, and kind of little. It brings up a lot of thoughts that way. So,
Yeah.
being a specialist and being having tested both academia and industry and working with various people out there, how you think is the best way where dental professionals collaborate with more physicians, or and the vice versa thing, to ensure a better systemic health that way, because ultimately we are looking to increase the health quotient of the society. That's what we are all I think aiming for with all innovations and sciences. Yeah.
Yes, yes, yes. 100%. You are absolutely on the right question, Dr. Gargi, and thank you so much for asking this important question, because one of the things that we often seen missing is there's a misconnection, or there's miscommunication, or there's a gap between the dentist and the general physician in general. And I believe personally that interprofessional communication is the key. Like how well we are able to communicate with all of the health professionals attached to overall goal of maintaining a good human body, right? So
Right.
dentists can share oral inflammation status with physicians. Especially, I will say that if a patient has diseases such as diabetes or cardiovascular disease, it should be a kind of a mandatory thing where the general physician has to have the oral health record of a person dealing with that kind of systemic disease. Then it will be starts integrating how we can integrate oral health into the overall systemic health. Now, it is also important to how to integrate oral health screening into primary care visits and vice versa. So, in if you have to imagine, it's an identify systemic issues earlier and improve outcomes across the board. So, let's say if a patient has a low diabetic profile and he looks healthy, but the person may have a poor oral hygiene, but the dentist can make a point clear, like if you persistently have age factor, other lifestyle factor, and you have a poor oral hygiene, then it may lead to diabetic down the road, right? You may have a cardiac issue down the road. So it is very important to maintain that kind of understanding between a dentist and a physician, that both the sides it is connected, and both the professionals should be aware of the consequences of ignoring the facts. Similarly, if a patient is having a diabetes and he is visiting his or her diabetologist, and they observe that the patient has a poor oral hygiene, then they can make a clear note like, you should visit your dentist as well as visiting to a diabetic clinic, so that there should be a balance between both the professionals. And at the end of the day, we all professionals, irrespective of categorizing ourselves as an oral health expert or diabetic expert, we all together are the health expert and the health professionals, where the ultimate goal is to give a positive outcome to the health and life of a person who is in disease. So better integrate we are, the better outcome it will be, and the better beneficial for the overall healthcare system.
Amazing. Absolutely. I second your thoughts and whatever you said, because I think this is very important, and I like the point that you said, I think this referrals and cross referrals, it's very important, because we cannot be experts in all the things. It is not possible.
No.
So if a diabetologist is expert in his domain, a periodontist is expert in or her own domain. So I think if this cross referrals happens, then I think it's very good for the patient or the human being that we are looking to elevate the health for. So I think that's a fantastic way you explain. Thank you, Rajiv, once again.
Yeah. Yeah.
Are there any specific oral care habits that you think are actually valuable or important, but they are, they often go unnoticed. So, what would be your take on this?
Yeah, I want to emphasize on two things in particular. The number one thing is the choice of oral care product. That makes a huge difference. So, irrespective of, terminating any name of the company. So,
Mhm.
if the oral care product has a lot of alcohol, alcohol-based mouthwash, if they are colorful, they are red, blue, green, yellow, orange, they have a lot of chemicals, they have additives. So what we can expect from those kind of oral care products? So when you rinse your mouth with that kind of chemical based oral care products, so what we are doing and what we are trying to achieve here, definitely we are trying to kill the germ and the infection, but you imagine a scenario, you're also killing the good bacteria along with the bad bacteria. So what we are doing is we are just making the oral cavity a kind of a naked atmosphere where other opportunistic infections come into the picture. And that's why sometimes when you rinse with the alcohol based mouthwash, colorful, you will feel a burning sensation, right? Because of the alcohol. And also, these colorful alcohol based oral care products also leads to xerostomia, dryness of the mouth, and may increase the chances of getting oral cancer as well down the road if you are consistently using them from 10, 20 years every day, twice a day, thrice a day. So when coming back to the oral care product, I think a gentle non-alcohol based rinses, toothpaste with natural antimicrobials like salt rinse. It's been in tradition for India for thousands of years, right? People used to brush their teeth with datun and neem, right?
Right.
And then the neem sticks, and our grandma and their grandma refers to rinse with salt rinse in order to maintain the inflammation at the lower level or even to kill the halitosis, right? So that's why if we are using the natural products which are made from sea salt or salt, it definitely supports the oral microbiome while reducing inflammation. Also, different modules like tongue cleaning and staying hydrated also often get overlooked, and that also play a big role when maintaining a good oral health. Uh, when we look upon the salt rinse right now, because I did a lot of research on the salt-based products in the last couple of years, so salt quality also matters when you have to rinse with the type of the salt. So, like the home-based salt, which we have, like table salt, it just contains two elements, sodium and chloride. So the two sodium and chloride will not give you as much benefit
Mm.
as when you rinse with a sea salt based rinse that has more than 50, 60 elements. And on top of that, sea salt base, especially the Red Sea salt, why it is called Red Sea salt? Because it's sea salt derived from the Red Sea. It is not red in color, it is derived from the Red Sea. And it has 82 plus minerals. So if you rinse and do toothpaste with that kind of quality based premium sea salt product, then it makes a huge difference in terms of getting the positive outcome of the oral cavity.
Amazing. I think this is a very new information that I mean, of course, salt rinse, as dentist or being in the profession, we have heard, and as you said, it's like a traditional thing in Indian, at least in Indian houses in the olden days. But
Yes.
information what you said about the red salt, or this is the sea salt that you are talking about. It's fascinating. I think that's a very new information for all of us. Thank you, Rajiv, for.
Yes. Yes.
Rajiv, we are talking with two dentists coming together and not talking about oral systemic health and not talking about oral cancer is just unforgivable.
Yeah.
So,
Yeah. I agree.
a very common question, and maybe it will help our audience to also understand better. So, what are the early signs of oral cancer that often go unnoticed? So, if you can
Yeah.
really help us with that answer, yeah.
Yeah. Definitely. I want to try to explain in the simplest terminology so that our viewers who are non dental professions can
Yeah.
understand this, right?
Right.
So when we talk about oral cancer, it is often overlooked by people in general because they believe that it's a common symptom and sign in our oral cavity and it can be healed or it can be cleared by its own, but it is not like that. So if a patient or if a person is suffering with the persistent ulcers which are not healable, let's say in 2 weeks of time, then it's a matter of concern. If a person noticed red or white patches inside the oral cavity, when we notice an unexplained bleeding of gums, irrespective of having a good oral health, a lump in a mouth that doesn't heal in a 2 weeks are often missed or misattributed. So that's one of the things. Another thing which have been noticing recently is that if you are feeling a numbness or difficulty in swallowing, are the other red flags when we consider doubtful symptoms related to oral cancer. Unfortunately, many patients don't seek help until the disease has
Mm,
progressed to a severe level. So that's why it is very important to understand and self-examine your oral cavity on a regular basis so that if there are early signs, they should approach to a good dental school or to a good dental clinic and get themselves thoroughly examined, x-ray, clinical visibility, as well as even biopsy if it's required.
right. So thank you. I think those small things are very important because sometimes, as you said, that people are also not aware about much aware. Though I think the dental community works a lot globally to make people aware, but I think still certain small things, uh, get unnoticed. Like one thing which I really liked, you say that if there is a recurrent ulcers, because sometimes. People just think, oh, it's going off, it's nothing much of a concern. So, but I think that's a very good point. If people can be more diligent about noticing themselves or,
Yeah,
check on their mouth. I think a lot
yeah,
of grateful diseases probably we can early diagnose and probably we don't land up into the disease even. So,
yeah.
yeah. So, how you think can both patients and clinicians do a better job of early detection?
Yeah, very good question, Dr. Rag. Really appreciate that for asking this question because I totally believe that as you have noticed, like there's a lot of great, I can say that social awareness, people, organizations, medical schools, even government involved with breast cancer, right? So
Yes.
they often have you seen the messages even on the billboard. Yeah, to that's to have your regular breast examination by the women itself, and they if they found any lumps or different condition which is not normal, they should approach to their gynec, right? So
Absolutely.
that's the way I think patients should be encouraged to self check their mouths monthly, just like in breast examinations we encourage to be done by the women. Clinicians should perform like every dentist, a patient reporting to them for any endodontic related query or they have any orthodontic related work or if you are just going for a regular cleaning. So they should often perform a thorough oral screening at every checkup. And it should not be annually. It should be like, quarterly because of the reasons of the lifestyle of the people have in general right now with so much of what you can say that junk food is involved, right? And that contains a lot of chemicals, lot of artificial flavors, colors, and spices. All
Mm.
those things add as a provoking factor to initiate the oral cancer into a much more flared form. So that's why it is very important to get a thorough examination by yourself as well as by the dentist as an expert to guide us in the right way. At the most, I want to say that awareness and routine examination is the key. Oral cancer is highly treatable if it is caught at early stage. So
Exactly.
we have to put an emphasis on that. It should be thoroughly examined, and if a minor sign and symptom is visible, then it should be taken to a great maturity level to undermine the factors involved with that sign and symptom and to get it treated as early as possible. And we have fantastic hospitals and research centers in India. So we have a lot of resources, we have a lot of talented people and professionals. So that's not an issue at all. And especially in Asia and India, I can guarantee 100%. So it's only about awareness and how well and fast we respond to that condition.
Absolutely. I absolutely agree with you. And thank you for giving this comprehensive overview of this, because it is very important, because early diagnosis for any disease per se, whether it is oral or, systemic, if we can catch the disease early, then it's actually easier, and it also less burden on the pockets for the patients as well. So that's
Yes.
also very important thing. Rajiv, you are known for emphasizing supportive care uh, during and after cancer treatment. So, can you share some practical insights or some tips, probably, in this
Yeah.
aspect? Yeah.
Yes. I mean, when I will say that when a person is diagnosed with cancer at that particular time, till throughout his journey of life, then that person is called a cancer survivor. Then the survivorship begins because it's really your gut and your gratitude. Now you are fighting with a life threatening disease. So definitely you are a kind of a real hero in terms of defending your life for this devastating condition. During your fight with this cancer treatment or with a cancer disease, there are multiple side effects which we noticed as a part of the treatment. A person who is going radiation therapy, chemotherapy, or any other advanced cancer treatment, they often have multiple side effects. And when we talk about the oral cavity, it is called as chemo mouth. When you have the oral side effects of the cancer treatment inside your mouth, particularly chemo mouth sores, mucositis, dry mouth, difficulty in swallowing, and alteration of taste. So you don't feel eating or drinking food because it gives you a very yuck feeling. You can't take it inside your body. So imagine a situation you are already under a kind of a health threat because of this devastating condition. And on top of that, you have to deal with all the financial, emotional, and physical trauma in order to deal with this, fighting the disease based on the treatment. And on top of that, you get side effects, and that especially the oral side effects. I you have many people have noticed, people lose their hairs, during the treatment and they become bald. But I want to say that that's still okay. It's related to your appearance and aesthetics. But if your oral cavity gets disturbed by the oral side effects, then you don't able to take the food, you don't able to speak, you don't able to communicate, you don't able to take the nutritions, and then your overall systemic immune system further progresses down. So that's why it is very important. Now, in supportive oral care for the cancer treatment, it is very important, first of all, to avoid any alcohol based, chemical based, colorful mouthwash or toothpaste in your oral cavity, because when your oral cavity is already immunocompromised by the cancer, right, and then top of that it is further deteriorated by the side effects of the cancer treatment, then your oral mucosal immunity is so very low that it cannot tolerate the harsh chemicals, alcohols, and preservative inside those oral care products. So that's why you have to stick back to the natural ingredients, the natural products, in order to maintain the best of your oral care. And that's why, and that's how the mineral rich sea salt plays a big role in like why it has to be an important part of the oral care during, cancer survivorship. All the leading hospitals in the US, in the Europe, and even in the Asia, I'm not sure, but 100% in the US, they recommend salt rinse as a part in managing the inflammation related to uh, oral side effects of the cancer treatment. So definitely the type and the quality of the salt makes a big difference. If you are taking a premium mineral rich sea salt from the Red Sea, definitely it gives you more added benefits. And another thing is that to keep your oral cavity hydrated. So water plays a big role, right? So 70% of the human body is water, right? 70% of this earth is water. 90% of the oxygen is coming from oceans. So water is a big role. Our brain has 70% water.
Mm.
So you have to keep hydrated your oral cavity as much as possible. And definitely water is a big role. You have to drink water. But in context to Indian culture, again, I coming back to that. If you can have your probiotic drink in Hindi, which we call as lassi, right? So if you make a yogurt drink with the curd and water and have a little bit of salt and sugar, then at least you can keep yourself hydrated. And definitely the lactobacillus containing of those curd will also help in maintaining a good oral health. So all these basic things and coming back to the nature, coming back to the natural ingredients, make your life much more better, especially when dealing with the cancer survivorship.
Right. I mean, thank you, Raji, for that wonderful explanation, because I know it's a very broad thing that we are trying to
Yeah.
convey in a very small time today. Like I'm a very passionate science communicator, so I keep
Yeah.
writing. I have started a writing part on LinkedIn named as Dental Generics. So other day I wrote, it was just out of my curiosity, because today we are talking a lot about oral care and things like that. So I was thinking, is it possible any day that we just bring up a mouthwash which would be more personalized in understanding the genetic makeup of a person? And probably we are going that way when it comes to
Yeah.
medicine, the way it is progressing. Well, that's a fun
Yeah.
part, but I always imagine these things and put out my thoughts, because I think if somewhere those things spark something in somebody, probably the younger generation, the aspiring generation, they might come out with
Yeah.
innovations. Yeah.
Yes. 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 100%. And I totally agree with you, Gargi. Like you are on the right spot, and that's what where the dentistry is progressing. It's more towards the genetic side and how the things are moving in the real world.
Absolutely, absolutely. Um, so I think like how we have talked about a lot of practical aspects now related to oral care and stuff, but then how do you envision how to prevent, particularly prevention I'm talking about, when it comes to oral cancer in the future? How integrated approach you think would be, in the context that can be highlighted, or it's coming our way?
I think the most important thing is here is to break the silos. The oncology department, the dentistry department, and the primary care physician department, or we can say that our general doctor, they
Yeah.
should share the patient data
Mm.
and create a co-management plan. So where a patient can or a health professional can have an access to all the profile of a person. So as far as my understanding, right now in India, if I visit to a dental clinic, right, that dental clinic doesn't have access to the patient's medical record, right? Like what last time I was admitted, what recent surgery I had gone through, what other treatment I am going through, until unless I give myself an history. So sometimes, people intentionally and unintentionally miss the key points or delivering that information to the dentist and the vice versa, right? So if you're going to a physician and you forget to tell the physician, you are having a severe periodontitis, right?
Mm.
So that makes a big difference. And then we can have a shared integration of the data among all health professionals. That will be a key. And importantly, incorporating oral health as a part of protocols in providing supporting products, in providing reduced complications, and altogether it will help in reduce the hospital readmissions. It will be good for the patient itself, but also it will be good for the healthcare system itself to, to lower their burden of so many patients coming to their clinics every day, especially in the government setup where you have a huge patients that line up since morning to get themselves, checked by the physician or the dentist itself. So it will be, I think, a win-win situation for everyone.
Right. I think this is a fantastic point that you brought up, because yes, access to data. Because see, like as you rightly said, that when we are also taking, sometimes we take medical records, but it also depends on what response the patient is giving, and sometimes maybe due to some professional burden, we miss out certain points of asking the patient. So it's a very dicey situation depending on our the patient's individual approach and our individual approach as a clinician. But as you rightly said, if we have a platform like that where it's like a one click information, I just click and see, okay, this is the things, I don't even have to ask the patient, where he or she might sometimes not intentionally, but unintentionally they might also not give the correct information, but which might be very vital when it comes to the treatment strategy that we would be seeing. I mean, that's a fantastic point, Rajiv. Thank you for that.
Yeah, yeah, yes, thank you.
Rajiv, a different question. Something I think which is very interesting in your career is, like, as we started, we were listening to your story, that you transitioned from academy to industry, and not only that, in a leadership role in industry. So, what motivated that shift?
Well, as I mentioned earlier, I wanted to bridge the gap between innovation and impact.
Right.
In academia, I love the research and I love each and every part of academia, from teaching the students, engaging with the research, discussing with the peers among the different things, what's going on in the world of science and research. But I still realized that translating science into the real world solutions, like developing better oral care products or developing a much precise clinical protocols, require the agility and the resources that only industry can offer, because in academia you have limitations of how far you can go with your research, how far you can expand a development of a particular product, or how far you can implement the changes to the institution level, because they have different regulations, they have different foundations, and they have to follow that protocol. And that's, I totally understandable from their perspective. But if you want yourself to expand your horizon, then definitely you have to go out of that system and move towards an industrial area where you have more leverage to all the resources, and you can fund new things, or you can mm, culture new ideas, and then develop these strategies how you can implement the lab science into the real world solution. So it's altogether a different thing, but I enjoyed this transition, and definitely it gives me a better perspective how we can make a difference in the life of a person and see the real time results.
Absolutely. I mean, that's amazing, because this, I think, more hardcore academic people transitioning into industry also enriches the industry as a, the knowledge base, because when expert minds, subject matter, or whatever expert minds come together, I think it's like a win-win scenario. And at the end
Yeah,
of the day, we are all striving to do something for people, whether we come from a
yeah,
life science background or clinical background or whatever it is. So it's all about how we are building a product or maybe a service. At the end of the day, we want that some benefit to the human.
yeah.
So I think.
Yes, yeah, and also I would appreciate the work which you are doing. It's also something turning from academia into more kind of an social awareness, right? So it's an industry, but definitely your work is very pivotal in understanding people, different concepts, different scenarios, different talks. So definitely a great thanks for you as well for making these talks and me these things available to the people for understanding.
Thank you. Thank you for that appreciation, Rajiv, because I think it's important to tell the stories of science and innovation. Very important. It's because it's not that it's just on journal papers or we are doing something inside our lab in the industry, but that when we see tangible results, I think communicating science, I personally feel, is very important because that's how we know about what is actually our doctors or researchers or scientists are actually doing for us. I think that inspires me to bring up such fantastic stories and career journey like yours. I mean, I really feel very blessed that I can connect and bring such eminent people on my podcast. Thank you, Rajiv,
Yeah,
once again.
yeah.
Yeah.
Thank you, thank you.
This is like a career related question I would ask you. If somebody is considering a similar makeshift from academia to industry, so what advice would you give them?
Yeah, great question. Lot of young students and lot of people who are in the early stage of their career usually approaches me almost every day how they can shape their future. I mean, I'm not exaggerating, but lot of even undergrad students who are like from an India perspective, you can say that who are in their undergrads, like doing their bachelors, and even in the US, even in the Asia, it's almost like an everyday affair. People approaches me how they should, strategize their career, and I want to give them. It's a long story, and how they have to develop all these strategic skills in order to be successful in their academics and careers. But the bottom line is start thinking in terms of value.
Yeah.
What value you can, or your research or expertise solves the real problems. And as what the work you are doing, Gargi, and I just want to communicate to them most of the time, like learn to communicate your ideas beyond journals into the market, into the industry, or patient benefit language. And networking also helps too. Many roles are not posted. You have to look for, you have to create your roles. In order to do that, there's an defined strategy. And that strategy is basically a 12 core program that you have to understand how to build the perception strategy, how to build the information filtration strategy, how to collaborate strategy. There are 12 different strategies, and definitely if you are able to master those strategies, definitely you are able to succeed in making those shifts into different industries or different domains from time to time. And it's altogether a different, I will say that, a time scenario where we have to sit together and discuss what and where, when you can apply those strategies. And definitely, but overall, I just want to give an overview that you have to be a more understanding how to create a value of yourself. And that's from where all the things will start happening in the right perspective.
Absolutely. Thank you for that fantastic advice. And I'm sure that your words of wisdom will actually inspire many people who are listening and who are probably as in the aspiring stage. Because I understand that in life, like when we try to shift careers, so transitions always bring confusions, but I think confusions are always good. I personally that actually helps us to introspect and we actually understand like what exactly we are wanting, and as you said, that is a very important, and I want to repeat that we need to see what value are we bringing out of it, or what value we want to put forward. So I think that's the most important thing. As you said, if somebody is trying to move from academia to industry, So it is also important if a researcher, suppose a PhD student, or after having postdoc, or things like that, uh, how can they prepare or make themselves more attractive to companies looking for innovative thinkers? Because I think PhD or any research journey gives it just sparks more of critical thinking aspect, if I'm not wrong. But then
Yeah,
even I have seen that many good scientists are very good at their work, but they are not good at presenting, again, your word, value. So can you
yeah.
give some suggestions which would be really helpful for people?
Yeah, definitely, Gargi. I think the bottom line is I want to say that strategy, how you want to strategize and how you want to master those strategic skills for academic and career success. Mm. Without, disrespecting to any profession, any degree, or any kind of education level. Still, if you are a bachelor's or master's or PhD, it will not lead to the right position which you really aiming for, right? You will not achieve the highlight of your full potential until unless you understand how to use the potential. And in that scenario, the role of mentor, a role of coach is much more broader than we think upon right now. uh, I have a great love for Generation Z, our young buddies nowadays. I love the young kids in their high school, in their school, or in their early days of college. You know, nowadays they love to follow the social media, and they don't write, and they don't follow the core people who can make their life into a much better position. So I always give, when I talk to Indian side of my society, because being a very strong Indian background, and I love the Indian culture so very much. In the epics of Mahabharata, the Krishna and the fight between Kauravas and the Pandavas, the Arjun only wins the battle because the Krishna was with him, right, as a sarthi to the horse, right. So that's very important. And as you know, Krishna, God, he didn't took any weapon, he didn't fight with anyone, he didn't argue with anyone. It's only because of his mentorship to Arjuna that make him win all the battles, irrespective of they have minimum army as compared to the counterparts of Kauravas, right? So just want to touch a mythological era here. So that's how, I mean, in this real world also, in order to make yourself more valuable, you should have that kind of problem solving mindset, not just that technical skills. So we should understand that our degrees give us technical skills. If you are a dentist, you know how to drill, fill the teeth. You don't know how to optimize those skills into the real world scenarios in a different industrial domain. And in order to do that, you have to understand some key scientific strategies. And definitely, I will sometimes, again, I will sit with you in another episode of yourself discussing what are the key strategies one should focus on and how those strategies can play a big role in a career shift, irrespective of the position, irrespective of your current scenario, irrespective of what age are you. So as early as you learn these strategic skills, you will be more capable in order to make proper utilization of your potential. So it's like if you start doing an early exercise in your life, if you start driving at the age of 18, so you can enjoy, let's say, if a person has 100 years of life, if he starts driving the car at the age of 18, he can drive that car till 82 years of his age, right? It's how the skills matter. So if you start driving the car at the age of 42, then you already, lost 20, 24 years of your time period where whether you could have enjoyed driving. I'm just giving an analogy. So that's how, if you want to use the strategic skills, I always emphasize students to use at very early stage of your career, because that will be a kind of a directional point where you can make it or break it through your career, as well as your overall professional success. So it's very important, and you have to understand regulatory, operational, as well as business implications of your work. Even just a little thing and a little shift in your mind, it will goes a long way. So definitely we have to be more strategic thinkers, and that's how you have to make yourself more valuable for the next person so that they can really want you and demand you for their work rather than you want to become applicable or an applicant to their work.
Amazing insight. I think this is very, it's gold. What you said is gold. And I
Thank you.
think, yeah, I think it's very important, and it is very valuable if somebody is listening to this right now, particularly who are in the aspiring stage of their career. Because as you said, the earlier it is almost like early diagnosis, like
Yeah.
earlier you understand and earlier you implement and learn and implement. And also another thing, just I will like to add here what you said is one attitude of lifelong learning should be there,
Yep.
because that's the key to anything. And
Yep.
I completely fully agree with what you said about the mindset shift, because it's all inside here, and just that we change our perspective, we can learn and then move forward. So yeah.
Yes. 100%. As Mahatma Gandhi mentioned that education starts from birth and ends till death.
Absolutely.
So you have to keep on learning throughout your life journey.
Absolutely. Absolutely. Just one question comes to my mind as we are speaking, because there are a lot of, because I have friends, like in family and friends, who have several perceptions when it comes to cancer as such, or particularly oral cancer. So I get the typical questions, and as you know that we have a deadly disease now, that is I'm not trying to dishonor any platform that way, search engine platform, but we have Googleopathy. That is how I
Yeah. Dr. Google, right?
Google, and it will always, whatever question you ask, people ultimately get confused or, fearful. So, coming back to the question, what is that one myth about oral care or oral cancer, if I may put, that you think,
Yeah.
it's crazy?
Yeah.
I mean, yeah,
Yeah, what means that's commonly seen in day-to-day life related to oral health is that the bleeding gums are normal. People think that, I am overly brushing or it's rigorous brushing or something. Just it's not to pay attention, but they are not. Bleeding is a sign of inflammation, not just brushing too hard. So another a kind of a myth is that ulcers or irritation during cancer treatment is unavoidable. It is not. You have to really take care of the small signs, small symptoms, and don't ignore those signs. The body responds to our immune system, gives us signals, in terms of they cannot speak with us. So they give us signals, I have developed this ulcer, I have developed this pain. So respond to it, throw attention to it, approach your professionals, and don't believe in social media. 100%. I'm a fan of social media. So with due respect to all the social influencers, I respect your work, but lot of influencers just try to put bluffy stuff in order to get more reviews, more views, and try to monetize that social platform. So that's the reason people often get confused, right? With so many things in YouTube, Google, Insta, and so many social media platforms. So I don't want to go into that detail, but stick to that influencer that has credibility and that has kind of an medical degrees behind their name, so that you can at least rely on the messages that media is providing to you. Otherwise, the best bet is to visit to your dental professional medical healthcare system and the clinics, and to get themselves the real professional voice what they are saying, because at the end of the day, it's your body, it's your life, and your life is not only important to you, but to your loved one, also to your father, your mom, your husband, your wife, your children, your different relatives, your friends. So you have to take care of your life on a priority basis.
Yes, thank you, Rajiv, for bringing that very important point, because as like you, I'm also a very social media fan, and I use it in terms of communicating things. But this also is becoming a real problem, because when we see so much of information coming from because the degree that we have earned, the experiences that we have earned with years, it's not a joke. I mean, you cannot just read five blogs and make a video script and just blabber. And that is something I think it's becoming a concern now, because if people stick to their area of expertise and they speak about it, I think that would be a good way. And social media is really powerful, and that way we utilize the real power. And I think I was talking in some other episode with another guest, so I was mentioning one thing, that why a post becomes viral. If you have seen, the emotion is fear that is being aggravated. And we generally, if we I'm fearful, okay, I'll send to my parents, then to my friends, and then to it's like a loop.
Yeah,
So I think you have to be, what Rajiv you said is very important, that you have to see where that information is coming from. I mean, you have to understand that. So otherwise, misinformations get more virality nowadays, which is
yeah,
unfortunate.
100%.
uh,
Yes.
you wrote five books. Oh my God. I mean, I really want to talk about it. So, before, I mean, some book idea, or you can also suggest some perspectives for people. But before that, I would like to know, what are those five books that you have written? And if you want to share anything specific, book which is more close to your heart. Yeah.
Yeah, I have written five books. Well, one book is related to dental horizon, different aspects of dentistry. Then another book is fundamental of clinical trial and research, how you have to conduct clinical trials and research. Another book I have written about sea salt, how the sea salt is overall impacting the whole system. Then I also wrote a book on hospital infection controls. I
Wow.
also wrote a book on dental plaque, a biofilm, how it is developed, when it is developed. So I think all of the books are written at the different stages of my career, and they have a different heart and soul into that, depending upon that time. But still, I think one of my book, Fundamentals of Clinical Trial and Research, is often used by many young investigators in understand the how to move forward in their clinical research domain. And also my recent book on sea salt is also getting a good traction in the US. But I also like reading a lot of books from another authors also. So one of the book, like Start with Your Why by Simon Sinek, really helped me reframing my work, because it reminded me that the purpose drives innovation. In the research and development, it's easy to focus on what, but it is the why that gets people to care and engage. So it is very important to understand your why you are doing this thing, and what will it will bring to you. So that's why and what will make your whole career and your whole perspective into the right direction.
Thank you, Raji, for sharing that. And definitely, I'll catch that when we meet in person. I'm definitely going to grab one copy, signed copy from you.
Yes, yes, 100%, 100%.
Yeah, yeah, Rajiv. Thank you. Can you tell, or can we fix that one thing, the way oral healthcare or is currently approached? So whether it is clinically or publicly, so what is that one thing which you think could be fix,
Yes.
and we can change the scenario up, for a better.
Yes, yes, yes. 100% Gargi, very great question. So I think, as we touched upon previously, I would love to see an integration between oral health into every medical visit, not the dental visit. So imagine if your blood pressure or glucose and oral health scores were part of every checkup. And this level of visibility would elevate prevention and reduce chronic disease burden dramatically. So when a person visits to a diabetologist, when they are giving their vital signs, like your weight, your 3 months of your blood glucose levels, right, HbA1c and everything, there should be a column there, what is your oral hygiene index level. And if we are able to achieve that kind of precision in terms of integrating oral systemic health, then I think we are good with everything, and everything comes a part of that.
I think it's a
So,
fantastic thing. Mm.
yeah, a diabetologist should understand what is your oral hygiene index when when that doctor is checking the patient visiting to his or her clinic related to diabetes situation. So that's the whole key. I think that will make a big difference.
Absolutely. Thank you for sharing your insight. Like, what is your next big thing or your mission to bring oral and systemic health, together? What is that? If there is
Yeah,
have any, fantastic,
yeah.
I'm sure you have one.
Yeah. So I'm working with researchers and institutions around the world to create stronger data linking oral care with systemic outcomes. And also, I am also in the verge of and in system and processes of developing the next generation oral care products tailored for patients with specific needs like cancer or post-surgical recovery and
Mhm.
backed by real science and the natural ingredients like sea salt that will make a big difference in the life of the people. Another great perspective in my mind is to educate the students and the young professionals in the best possible way. So I'm also trying to build up learning platform for them, though don't have so much time to do so. But at least I can guide them, and they can become a kind of a learning tool for them, so that they can become more powerful, more strategic, and can utilize their full potential. Because I realize that our students, especially in the Asia and the India, they are full of potential. I mean, unmatched potential you can see anywhere in the world, but they don't know how to strategically utilize their potential in the right direction. So if they are able to understand it, and if they are able to learn that skills, coming back to the strategic skills, then I think they will able to make the full use of their potential, and they will be succeed a way better in their life.
Right. Thank you, Rajiv, so much for answering all my questions. And I it was a very it's a value that you have put through today through all your answers. And I'm sure this episode, it's a milestone for me, of course, for my podcast. But then the knowledge that you shared today is very valuable, and I think we have covered quite a breadth of things. And
Yeah.
of I would take cue from one sentence that you told a few minutes back, that we really need to do another episode on how we can actually tell students about building up their strategic skills. I mean, students both way, like from clinical side as well as any researcher, or how they can actually do. And I'm sure I'll get back to you on that once again.
Yes, yes, definitely. It's an honor and pleasure to be here, Dr. Gagi, with you, and definitely I enjoy our candid views, discussions, and sharing our kind of a mutual collaborative opinions with you. And I must appreciate the great work you are doing towards social awareness coming from the professional side, rather than just a marketing bluff or kind of a to increase the viewership. So I must appreciate all the great work you are doing in this social domain. So that's great work to you and your team. And also, anytime you need my experts or expertise or opinion in other topics, I will be more than happy to be a guest on your show. Thank you so very much for having me in your show.
And thank you, everybody. I'm sure this episode has blown your mind. And please subscribe my channel to see more experts like Dr. Rajiv. And thank you so much for watching. Thank you, everybody. Thank you, Rajiv.
Thank you. Thank you. Bye bye.
Bye.